Hi, my name is Laura Mutzko. I am the owner of Mutzko Insurance Services. I've been an insurance agent since 1997 and I specialize in the senior market. I'm here to explain to you about Medicare. So what we will cover today is the basics of Medicare, what Medicare Part A is, what Medicare Part B is, how to enroll and what to expect. We're going to talk about Medicare supplements, Medicare Advantage plans, and the prescription drug coverage. So what is Medicare? Medicare is health insurances for people who are 65 years and older, people who are under 65 with certain disabilities, people of all ages with end-stage renal disease, and people who have ALS or complications due to chemical exposures during the war. They have to go through Social Security, but they waive that 2-year wait period. It is managed by the Center of Medicare and Medicaid Services, and it's often called CMS. And you sign up through your Social Security Administration or your Railroad Retirement Board. If you're a railroader, you go to the Railroad Board. If you're not a railroader, you go to Social Security. So Medicare. If you're drawing Social Security prior to 65, Medicare will automatically send your enrollment pack in approximately 90 days in advance of the first day of the month in which you turn 65. So if you're already receiving Social Security, you will automatically get your card in the mail. If you're not receiving Social Security, or if you're delaying your Social Security, you need to initiate that conversation with the Social Security Administration and sign up for Medicare Part A and or B, and we're going to get to that in a little bit. You want to do that approximately 45 days before the first day of the month that you want to retire. So Medicare, there is no such thing as a Social Security office. There's no such thing, as a Medicare office. We use the Social Security office is like the funnel to get to Medicare. Social Security is the one who checks your hours of working and things like that. So there are several ways to enroll in Medicare. You can call the 1-800 number and make an appointment at your local office. You can go onto socialsecurity.gov to enroll in Medicare. You can call for an appointment, and you can enroll online or enroll over the phone. The easiest way to do this is if you are turning 65 and you want to have your Medicare and you're not receiving Social Security, it's just to go right online and get it done. It takes about 5 minutes. That is your Medicare card. It has your name. Whatever you have on your Social Security card will be on your Medicare card. So your first name, middle initial, if you have one, your last name. And then if you have a junior or senior, or if you're the second or the third, if it's on your Social Security card, you'll want to make sure it will be on your Medicare card. Then your Medicare claim number is a random string of letters and numbers. And then Medicare assumes you want both the A and the B, and we'll get into that in a little bit. You want to sign your card. If you lose your card or destroy your card, you can contact Medicare either online or over the phone and order a new one. It takes about 2 weeks to get. Okay, your Medicare basics. Your Medicare Part A is your hospital coverage. Medicare Part B is your medical coverage. And then Medicare Part D is your prescription drug coverage. Anytime that we talk about the original Medicare, we're talking about the A and the B only. And the only one of the three that you do not enroll in through Social Security is your Part D. You get a Part D plan either through a broker such as myself or directly through a company. So your Medicare Part A includes your inpatient hospital care, your skilled nursing care, your home health care, and your hospice care. Your Medicare Part B is your doctor services and outpatient care, your preventative services, your diagnostic tests, your therapies, and your durable medical equipment. There are also what we call a Part B medication. An example of a Part B medication would be a chemotherapy drip. Anything that needs to be administered in a clinical setting will fall under the B as opposed to the D. And then finally, the Part D, that's your outpatient prescription medications. It's what you administer to yourself on a daily, weekly, monthly basis. So I'm going to break these down, and I'll break them down a little bit further. So your Medicare Part A. Most people do not pay a premium for the Part A. It is not free. Just all the years you work, part of the taxes that were taken out of your paychecks, allows you to get your hospitalization at a zero premium when you turn 65. So that's why they call Medicare an entitlement program. You're entitled to it because you paid for it. You had to work 40 quarters or 10 years in a job or jobs that withdrew taxes. If you didn't work enough quarters, you can contact, or if you didn't work enough quarters, you can buy into the Medicare Part A, but there's a pretty big premium for that. If you want to know where you're at in your Part A eligibility, you can contact the Social Security Administration, and they'll let you know. Okay. So your Medicare Part A, so you want to look at Medicare as like a big form of Swiss cheese. Medicare's the cheese, and there's all these holes in it. So next several sets of slides, I'm going to explain those holes. Later on in the presentation, I will explain how you fill those holes. All right? So under Medicare Part A, again, it includes the inpatient hospital cost. If you go into the hospital under Medicare Part A only, you will owe a $1,408 deductible per benefit period. That a benefit period and the days in the hospital are two different time frames. That $1,408 is going to cover you for the first 60 days in the hospital at 100%. A benefit period starts the day you go into the hospital, and it lasts 60 days after you get out of the hospital. So what I want you to take away from that is there could be multiple deductibles in a year, just depending on how often you go into the hospital. But for those first 60 days in the hospital, Medicare covers you at 100%. Your surgeries, your consultations, your amputations, your meals, your linens, the whole 9 yards. But if your care goes beyond 60 days, Medicare will continue to pay, but you're going to have a co-payment of $352 per day from days 61 to 90. And then if you continue needing care in a hospital, Medicare again is going to continue to pay, but you're going to have a $704 co-payment per day from days 91 to 150. Then anything over 151 days, you pick up the whole cost. Now, also under Medicare Part A is your skilled nursing benefits. That's for you to be rehabilitated due to an illness or an injury in a skilled nursing facility. Medicare will pick up the first 20 days at 100%. You have to have been in the hospital for a minimum of 3 days and has to be a Medicare-approved skilled nursing facility, but most importantly, you need to show improvement based on Medicare's guidelines. If you stop showing improvement, Medicare will stop paying. But maybe you had that major stroke and it's going to take you longer to get out and about. Well, as long as you're showing improvement, Medicare will allow you to stay in a skilled nursing facility, but you will have a co-payment of $176 per day from days 21 to 100. Anything over 101 days, you pick up the whole cost. Then also under Medicare Part A, you will have your home health care. Now this is by doctor's orders only, so it must be medically necessary. So that's your skilled care, changing your bandages, checking your heart rate, your blood pressure, your urine output, and your therapies. You cannot exceed 28 hours a week or more than 8 hours a day. It must be a Medicare-approved home health care agency and is meant for people who are confined to their home, whether it's too difficult mentally, physically, or emotionally to get your care on an outpatient basis. Then finally, under Medicare Part A is your hospice care. You must be certified as terminal by a physician, which means your lifetime expectancy must be 6 months or less. But nobody has a crystal ball, so maybe it's the 7th, 8th, 9th month and you're still alive. Well, this is Medicare's terminology. You are eligible for 2 90-day benefit periods, followed by an unlimited number of 60-day extensions. All that means is Medicare is going to pay until you pass away, be it 5 months or 5 years, but it's palliative care only. And it's hospice care where you'd like it, in your home, in a hospice facility, or in a hospital. If you get care in a hospice home or a hospital, you will have to pay the room and board, but your care is covered by Medicare. Now, enrolling in your Medicare Part B. You can choose to enroll in Medicare Part B. The premium for the average person is going to be $144.60 per month. That's per person per month. There is no family plan. There is an annual deductible of $198. Now, Medicare Part B is all about enrollment periods. Everybody gets an initial enrollment period. That is 7 months. 3 months before you're eligible, the month you're eligible, and 3 months after you're eligible. If you do not enroll in your initial enrollment period and you don't have credible coverage, the only time you can enroll is during the general enrollment period, which is January 1st through March 31st, for your coverages to begin July 1st. Now, if you didn't enroll in during your initial enrollment period and you don't have credible coverage because you might have forgotten you turned 65, you might have been out of the country, or you simply didn't know you had to enroll, you'll receive a 10% penalty for every 12-month period eligible but not enrolled. Unless you have credible coverage. Well, what do I mean by credible coverage? Well, perhaps you're going to continue to work and you're covered on an employer-sponsored plan. Or perhaps you're retired and your spouse is going to continue to work on an employer-sponsored plan. You can delay the Part B. You simply do nothing. You can enroll in Part A depending on your group plan, and you can delay the Part B. Medicare doesn't want to know that you're not going to enroll. They just want to know when you are. So if you're going to delay your Part B and use your special election period for that, there's 2 forms that you need to get. These are online. A credible coverage form, which the employer fills out, and then you fill out a Part B application. You submit both of those completed applications to your local Social Security office, and they will process them, and then you will get your cards. So paying for your Medicare Part B premium. It is either deducted on your Social Security, railroad retirement, or your federal government retirement checks. If you're not receiving Social Security, they will bill you quarterly. If quarterly payments are too difficult for you to make, you can make special arrangements with Social Security to pay that on a monthly basis, but they typically want to generate that transaction, either applied to a credit card or take it right out of your checking account. And then the more you make, the more you pay. If you make more than $85,000 as a single person or $170,000 as a married couple, you'll pay higher premiums, and that's based on your modified adjusted gross income from the last 2 years. Okay, the reason for the 2 years is that's the most current tax returns that the IRS has available to them. You can, if you dispute this, there are forms that you can fill out and send in to try to get that back, that higher income level back down. If your income changes, you can take your most recent tax returns up to Social Security and they'll adjust that premium accordingly. Now, Medicare Part B, you have a $198 annual deductible. Then Medicare picks up at 80%, you're on the hook for 20%. It's as simple as that. Now in Ohio, we have a law that states if the doctors accept Medicare as a form of reimbursement, they have to accept what Medicare reimburses. They cannot balance bill you the difference. In other states, they can balance bill up to 15% over what Medicare charges. If you want to know if you're not in Ohio, If you want to know whatever state you're in, you can contact the Ohio Department of Insurance, and they'll let you know whether whether you can be balance billed or if the doctors will accept assignment. So, what Medicare does not cover. Okay, this is not a complete list, but this is the most common items that people ask me about. Medicare will not cover acupuncture or any alternative treatments or holistic approaches. It will not cover chiropractor if the only reason you go to a chiropractor is because it's part of your wellness program. Medicare will not pay for. However, if you have a diagnosis code or an x-ray to support you need an adjustment, Medicare will pay, but it's the manual manipulation of the spine only. Anything else in the chiropractor does in his office will be self-pay. Medicare will not pay cosmetic surgery, but it will pay for reconstructive surgery due to an illness or an injury. Medicare will not pay any custodial care. Custodial care is the 6 daily activities of living: eating, bathing, dressing, toileting, continence, and transferring. Medicare will not pay for. Medicare will not pay for deductibles, co-insurances, and co-payments that we just went over. Dental care or dentures. The only thing they're going to do regarding your teeth or your mouth is if you've had trauma to your mouth resulting in broken or missing teeth, or if you have your teeth removed before radiation, not during or after, but before. Medicare will not cover hearing aids or hearing exams, but it will cover a cochlear implant. Medicare will not cover eye exams or eyeglasses, but it will cover if you have an eye disease, macular degeneration, glaucoma, complications due to diabetes, and it will pay for cataract surgery and a set of contacts or glasses after cataract surgery. Then finally, Medicare will not pay any long-term care. So let's go back over the holes in Medicare. So the holes in Medicare Part A is at $1,408 deductible when going into the hospital, and that $352 copayment from days 61 to 90, and then the $704 copayment from days 91 to 150, anything over 151 days, and then skilled nursing, that $176 copayment from days 21 to 100. Then the Medicare Part B, the whole is $198 deductible, and then 20% of the Part B services. So this is your financial risk. The problem with that is all these figures go up every year. The only one that's been consistent over the years is the 20%. The only one that's annual is the Part B deductible. But most importantly, there is no cap to Medicare. There's no yearly cap or lifetime cap. It just rolls on and on and on and on. So what do you do about that? Well, that's where the insurances come in. Remember, you always insure yourself for a risk in the future. There are very specific plans that are designed to work right along with Medicare. We're going to go over those plans right now. But just remember, it doesn't matter if your mother, your sister, your neighbor, your brother, your spouse has a plan. They're very individual. There could be 2 different people in the household, could have 2 different plans. It depends on your personal needs. So your first choice to cover the holes in Medicare is your Medicare supplement. It's any doctor, any hospital. Your Medicare is primary and your supplement is secondary. Then you have Medicare Select supplements. It's any doctor, but only selected hospitals. Again, your Medicare is primary and your supplement is secondary. Then you have Medicare Advantage plans. They all have networks, and your Advantage plan is primary. And then finally, some people have group coverage, and that's retiree benefits from your employer. And nowadays, it's mostly the big guys. You have the school systems, the PERSs, the postal, federal, those kind of retiree benefits. So we're going to go through all these. How does the Medicare supplement work? You can purchase a Medicare supplement on a guaranteed issue basis, meaning we ask no health questions if you enroll within these three bullet points. One, if you enroll in a Medicare supplement within 6 months of enrolling in your Medicare Part B, we ask no health questions. Two, if you lose coverage through no fault of your own, we ask no health questions. So losing coverage through no fault of your own is the fact that you're retiring from your job causes you to lose health coverage through no fault of your own. And then the third one is if you leave a Medicare Advantage plan within the first year of enrollment. Beyond these three bullet points, your health will come into play, where you will have to answer health questions. And most companies, if you answer yes to any of those health questions, they will decline you. If there's only one or two companies out there that will take you, but they charge you more than the average person. Okay. So they're typically, you pay one monthly premium. You can go to any doctor, any hospital, anywhere in the United States that accepts Medicare. These are health insurance policies sold by private insurance companies. They must say Medicare supplement insurance. They are often called Medigap. So Medicare supplement insurance and Medigap is the same thing. And they are designed to cover those holes in Medicare that we just went through. Okay, so anytime you're going to see a Medicare supplement, you're going to see this grid. And it doesn't matter what company you choose. Every company that's allowed that Medicare allows to sell must offer Plan A. So these are called plans. Plan A, B, C, A, B, D, F, G, K, L, M, and N. All right. No company can move benefits around. No company can add benefits. So it's the same plan no matter what company you go to. All right, so we're going to outline the Plan G because it's the most comprehensive plan that Medicare has to offer. Your Medicare Plan G, the first component under basic benefits, those are the days in the hospital from 61 to 90 and 91 to 150, plus the 20% of your Part B services are all picked up under the first component, a Medicare Supplement Plan G. The second component is the skilled nursing co-insurance. That's a $176 co-payment per day from days 21 to 100. It's picked up under the second component of Medicare Supplement Plan G. The third component is your Medicare Part A deductible. That's at $1,408 deductible when going into the hospital. It does not cover the Part B deductible, but it does cover Part B excess. That's if you get care outside of the state that you're in and the doctor's balance bill, they will pick up all of that balance billing. Or if you're in a state that balance bills, if you have Plan G, it'll pick up all that excess billing. And then Medicare is only in the United States. There's no coverage outside the United States. Your supplements are going to cover you for emergency foreign travel. It's typically a $250 deductible and 80-20 plan for the first 60 days out of the country for a lifetime maximum about $50,000. Now you have to remember that you have to settle up with whatever country or facility that you're in, come back and put a paper claim in because no facilities outside of the United States can bill Medicare. So when you're looking at this grid, you think, well, I don't know what plan I would want. Well, I will tell you, Plan A and B, most people don't take because it doesn't cover enough. In my experience, Plan D is not offered by a lot of the companies. Your high deductible Plan F, you have to reach a deductible of $2,340 before the plan kicks in. Okay, so that's of any services, the first $2,340. Then it'll kick in at 100%. We outline the Plan G. Your Plan K, I'm not a big fan of Plan K. It's going to cover the days in the hospital from 61 to 90 and 91 to 150. And it's going to cover your preventative services at 100%. But everything else, they're only going to pay at 50%. So diagnostic testings, therapies, blood work are all paid at 50%. And then it's going to pay 50% of your skilled nursing. So $176 divided by 2, 50%. 50% of the Part A. Deductible, it doesn't cover the Part B excess, the foreign travel. So basically, when you're true out of pocket, Medicare is going to pay its portion, but when your true out of pocket exceeds $5,560, the plan picks up at 100%. That I would Medicare Advantage plan would be a better bet than the Plan K. L makes a little bit more sense to me because it pays at 75%, and then your Medicare again pays its portion, and when your true out of pocket exceeds $2,780, the plan picks up at 100%. Plan M, if you're in Ohio, I've not seen a Plan M. And basically, it's going to cover your basic benefits, the days in the hospital from 61 to 90, 91 to 150, plus the 20%. It's going to cover the skilled nursing, and it's only going to cover 50% of your Part A. And it doesn't cover the Part B deductible, Part B excess. It does cover foreign travel. Your N, your Plan N, is a hybrid between a Medicare supplement and a Medicare Advantage plan. It is going to pay your basic benefits, just like the rest of them, but you're going to have a $20 copay for your office visits and a $50 copay for ER. It'll cover the skilled nursing coinsurances, the Part A deductible. It does not cover the Part B deductible nor the Part B excess. It does cover the foreign travel. Okay, so how these work. Your doctor bills Medicare. Medicare picks up its portion, shoots the balance to the supplement, and the supplement pays. All claims are done behind the scenes. And they are priced by the state you're in, the county you're in, the age you are, the plan you choose, the company you also choose. So there are multiple variables into the pricing. You can pay these monthly, quarterly, semi-annually, or annually. And if Medicare pays, the supplement will pay. If Medicare doesn't pay, the supplement won't pay. For instance, on this grid, have you noticed that there are not any prescription drugs? That's because if you get a Medicare supplement, you would have to buy a separate prescription drug plan to cover your what you administer to yourself on a daily, weekly, monthly basis. If you get care or medications in the hospital, it would be covered under your Part A. But if your Medicare doesn't pay for dental, hearing, so if your Medicare doesn't pay, your supplement doesn't pay. Now these will just roll over from year to year to year, but they will go up as you age. And that's just how they work. And then you can determine when you get your renewal whether you want to look around for another plan or if you want to stay with your plan. If you don't do anything, it's just going to roll over to the next year. Your Medicare Select supplements. Again, if you are in Ohio, we do not sell Medicare Select supplements. A Medicare Select supplement, or if you're in Northeast Ohio, let me clarify that, will limit the hospitals you go to. So a Medicare Select supplement will typically contract with a community hospital. And so that community hospital would be the only hospital you can go to for everything unless it's an emergency. So since we in Ohio have the premier hospitals downtown, it doesn't make any sense to purchase a Medicare Select supplement because there's what you losing in options doesn't outweigh how much you save actually. All right, so if I'm in Ohio, I would not do Medicare Select supplements. If you live out west, these are a better bet for you. All right, now you have your Medicare supplements. Your next choice is a Medicare Advantage plan. One or the other, you can't have both. All right, a Medicare Advantage plan is what Medicare put together as an alternative to a retiree benefit or a supplement. So if any company wants to sell a Medicare Advantage plan and they're approved by Medicare, then the Advantage plan has to take over all the administrative work for Medicare. So it's Medicare just subcontracting itself out to private industry. So a Medicare Advantage, under the umbrella of Medicare Advantage plans, you have HMOs and PPOs and PFFSs, MSAs, SMPs, POSs, and PSOs. So the two that you're going to see in this area are your HMOs and PPOs by far. Your private fee-for-service plans are being weeded out of the individual market. Your MSA plans are interesting plans, and in Ohio, we've just gotten one in, and it's pretty interesting. They give you money towards your deductible. So they're high deductible Medicare plans. SNP plans are dual eligible or chronic need plans. Medicare, Medicaid for your SNP plans. Chronic need plans would be if you have a condition that's diabetes or heart conditions or a very special condition, and we might be able to find a plan that's good for you. A POS, Medicare in its core is a point of service plan where you go, you get your service, you pay for it. A PSO, we don't have a lot of we don't have any PSOs in this area. The one I recognize the most, or is recognized the most, is Kaiser. Kaiser provider sponsored organization, but other than that, we don't have those here. All right, so a Medicare Advantage plan is also called Part C. So if it's Part C, Advantage plan is the same thing. You get all of your Medicare Part A and B services. They all use plan providers. So they're networks. They will often offer some vision, some hearing, some dental, and they will connect the prescription drug plan together. So if you have a Medicare Advantage plan, you don't have to buy a separate prescription drug plan. You use the prescription drug plan that's connected to your Part C. You cannot disconnect them. You're still in the Medicare program. You have all Medicare rights and protections. So how they work, you will typically have a smaller premium or a lot of times a zero premium plan. But then every time you use it, you're going to have a copay. So it's a copay system. So your supplements are premium based, your Advantage plans are copay based. So most of your preventative service are going to be at a zero copay, and they limit how much you could spend per year on your coverage. Where if you remember earlier in the presentation, Medicare Part A and B has no caps. Your C will cap what you can spend per year on your copays. All right, so when you're looking at a Medicare Advantage plan, you're going to compare it to Medicare Part A and B. So if you have Medicare Part A and you go into the hospital for one 24-hour visit, you're going to owe $1,408. If you have a Medicare Advantage plan for that one 24-hour visit, they might just say $295 copayment per day from days 1 through 5, or $420 copayment per day from days 1 through 3. If you have Medicare Part A and B primary and you go to a doctor's visit or a specialist, you're going to owe 20%. With the Medicare Advantage plan, they might say $5 copay for primary, $40 copay for a specialist. If you have Medicare Part A and B primary and you go to an ambulatory surgery center, outpatient hospital facility for a procedure, or if you get your therapies done, you would all owe 20%. With a Medicare Advantage plan, they might say $170 for an ambulatory surgery center procedure, $300 or $250 for an outpatient hospital procedure, and maybe $40 for therapies. So in a nutshell, All a Medicare Advantage plan does is take those large holes in Medicare and chops them up into little co-pays to make it easier for you to manage. But a Medicare Advantage plan it takes a little bit more effort. You have to make sure your doctors are in the network and your medications are on the formulary. And since these are run by private industry, the industry needs to continue to be profitable. So once a year, the government allows these plans to make changes to their plans. They can change the premium, the deductible, the co-pays, they can fool around with the prescription drug plan, eliminate some medications, things like that. They have to alert their policyholders at the end of September with what we call an ANOC notice, an annual notice of change. And in that change, they're going to tell you all the changes that the plan is going to have effective on January 1st. Then you'll have an opportunity between October 15th through December 7th to join, drop, or switch. So you have to take a look. Is that Advantage plan still going to work for you? Do you want to try something else? It's been my experience probably in the last 5 years, these have been very stable. There has not been any negative changes, only positive changes. So if you're happy with your plan, stay with your plan. Okay? But once a year, once you're in it, you're locked in it for a year until open enrollment. Group coverage. I don't have a lot to say about this because groups are all different. When you have the large retiree benefits, they can actually custom make their plans. But what I have to say about this is the coverages vary from company to company, as do the cost. Sometimes your group coverage retiree benefits are going to be more expensive than what you can get on the outside market. So don't assume that just because your company is offering it, that is the best deal for you. And so you should periodically check the open market to compare plans. We do this quite often with people who have retiree benefits. You'd actually have to bring in the summary benefits and the price that you're going to be paying for it, and we try to see if that we can beat it, either the benefits or the cost, one or the other or both. All right, but you're not obligated to keep your group coverage. All right, so finally, the Medicare prescription drug coverage. This has gone through many transitions. It started in 2006. So anybody who has Medicare Part A and or B can join the plan. You can have A without the B, such as somebody who's going to continue to work. You can have the B without the A, such as an immigrant who's come over later in life. They didn't qualify for Medicare Part A, but they certainly can buy into Medicare Part B, which strengthens that program up. You can get your Medicare, your prescription drug plans either with a standalone prescription drug plan, which you would need for a supplement. Your Advantage plans hook them together, and your group retiree coverages will offer you prescription drug coverage. All right, so you have an enrollment period. You have the same for the C as it is for the D. You have your initial coverage and the B. 3 months before your, let me just repeat that. You have the same enrollment period for Medicare Part D as you do with Part B. 3 months before you're eligible, the month you're eligible, and 3 months after you're eligible. Then just like the Part C's, you will have one time a year to make changes. Between, you'll get an ANOC notice, and if nothing affects you, you can continue on. Or if you want to join, drop, or switch, you can do that between October 15th through December 7th for the policy to begin January 1st. Then, if you continue to work, you can enroll in a Medicare Part D at the time you're ready to retire, and that would be under a special election period. What we do in my agency is we shop the prescription drug plans every year because they change. Unlike the Advantage plans, the standalone prescription drug plans will change every year, but your medications will change every year. So we actually, anybody who has a standalone prescription drug plan, we reach out to you prior to open enrollment to get your new list of, or your current list of medications, and then we shop them and get back to you. Okay, so the late enrollment penalty. And just like the Part B, if you don't enroll when you're supposed to, you will get a 1% of the national base premium for every month eligible but not enrolled penalty. You'll have that penalty as long as you're in the Part D program. The national base premium is about $35. You can contact Medicare if you didn't enroll. They will be able to tell you how much you owe. So you would owe the penalty plus whatever premium there is on the prescription drug plan, if there is one. All right, unless you have credible coverage. The VA is credible coverage. So if you are a veteran, it'd be to your benefit to check to make sure you qualify for those benefits. A high deductible plan that you might have during work, through work, is not a credible coverage plan. A regular retiree plan or group plan while you're working would be, where you have the premium and 80-20 plan. But a high deductible plan, no, is not as good as Medicare. Okay, so now there's 4 stages to the prescription drug plan. So Medicare established a deductible of $435. This time Medicare says any company that wants to sell a prescription drug plan, they have to follow this template, but they can enhance the template. They can take nothing away from the template. So what you'll find, a lot of the carriers are going to, they'll fool around with that deductible. They might not offer a deductible, or they might only offer a portion of the deductible for higher end medications. So you're going to see that fluctuate. So whether your plan has a deductible or not, you start with that. Then everybody goes to the initial coverage period, where you will pay a copay or a co-percentage of the rest of your medications. The plan will start the first prescription that you fill. So, and when your total retail cost of your medications, that is what you pay plus what the plan pays, equals $4,020. Then you go into the coverage gap, which also is known as the donut hole. Where what happens with that, you might have a copay during the initial coverage. When you get to the coverage gap, it moves to co-insurances. So if you have a copay of $25 during your initial coverage, when you get to the coverage gap, it'd be 25%. So if you get to the coverage gap, you will see an increase in your prescription drug costs. Okay, until such time as your true out-of-pocket exceeds $6,350. That is the copays, the deductible and the copays during the initial coverage, plus the 25% during the coverage gap. When that exceeds $6,350, you go right from the coverage gap over to the catastrophic coverage, where Medicare will pick up at 95%. So what do you do about this? Okay, well, the statistics are that only 10% of the population will gets into the coverage gap, and out of that 10%, only 5% get into the catastrophic coverage. So going to the coverage gap does not happen to everybody. When this plan was developed in 2006, people were all on high-end medications. The Zocors, the Zidias, the Nexiums, the Lipitors, and they were actually going by bus loads with their state representatives to Canada to get. So the government put this plan in place that brought all that commerce back in the United States and lowered the cost of prescription drugs across the board. Now, since 2006, you've seen the $4 Giant Eagles and $10 Walgreens. So it has lowered the cost of medications, but most importantly, what I see now, which I didn't see in 2006, was most people are on as many generics as they can get. So the first thing, if you're on a lot of name brands, you want to start looking at talking to your doctor about lowering those to generics. Of course, so not every medication is going to have a generic, such as lip or insulin, things like that. But you can manipulate this plan just basically about what medications you take, where you go to get your medications. So most companies are going to, most prescription drug coverages are going to have premier or premium or premier pharmacies. And if you go to those pharmacies, you should save money. However, if one of the pharmacy plans, a $10 Giant Eagle or $4 Giant Eagle, $10 Walgreens, if you will pay a less expensive price, if you pay it out in cash, go ahead and do that. Don't put it through your prescription drug plan. What you want to do is save that $4,020 on medications that you can't get for $4, your higher end medications, your tiers 3s, your tier 4s. So you can use the prescription drug plan in conjunction with the pharmacy discount programs, and that's totally acceptable. Now, you will get a formulary, and a formulary is a list of the medications that the plan has to offer. And it is my personal belief that you should take that formulary to every doctor's appointment that you have. Why? Because a doctor is not responsible for knowing what medications are on your formulary. Just as if you have a Medicare Advantage plan, and a doctor is not responsible for knowing if they give you a referral, whether that doctor's in the network or not. That's all on you. But the formulary is very important because it's going to tell you, it's broken down by classifications of medication. So there's 124 classifications of medication per Medicare's rules and regulations. You have to have at least 2 medications per classification, and out of those 2, you need to be able to get to a generic. It's going to tell you per classification, it's going to tell you all the medications and what tier they are, and the tier will equate to how much you're going to spend on that medication. It's also going to tell you if there's any specific requirements. Does it need step therapy? Is there quantity issues? Is there, if there's any qualifications to it, they'll tell you then. So bring that with your doctor, or bring that to your doctor's office, and they should be able to. That will help them out tremendously. That way, you're not going to be paying for medication that's not on your formulary or that is not a high-end medication. Okay, and again, you're going to get your ANAC notice with all the changes, and you can join Drop or Switch between October 15th through December 7th. If you are lower income, there is eligibility assistance, and it's based on your income and your assets. I would recommend, if you even fall near any of these figures, just contact Social Security. They'll send you a form you can fill out, send it back, and maybe you can get help with that. All right. So for more information, you're all welcome to give me a call. Here are my numbers, or you can go to 1-800-MEDICARE, or the State Health Insurance Assistance Program can help you. Your Medicare and You booklet can help you, and Medicare has a ton of other publications that you can download online. So in summary, we talked about your Medicare basics, your Medicare Part A, your Medicare Part B, how to enroll, what to expect. We talked about Medicare supplements, which include select supplements. We talked about Medicare Advantage plans, your HMOs, your PPOs. We talked briefly about group coverage, and then finally we talked about the prescription drug plan. Thank you so much.